Just this week alone, nearly 3 dozen people were disqualified from SNAP and the Temporary Assistance for Needy Families program after they were found to have intentionally violated the program rules.
For one reason or another, it could be income, not reporting on time. It could be also households moving in or out. So because it makes a real big difference for eligibility purpose, whether you have 5 in the household or 4.
According to Francis Damian, an investigation and recruitment supervisor for Public Health Bureau of Management Support, he says trafficking or crediting non-food items with their SNAP EBT cards is a common disqualification.
It's unfortunate. There's always going to be I like to say at least 1% of the whole total community that will, for one reason or another, start to abuse or misuse the program assistance, and that's unfortunate.
In the last 4 quarters of the year, there have been about 140 cases of disqualification. A first-time noncompliance offense results in a disqualification of 12 months. A second offense is 2 years, and a third is banned for life, whether on Guam or anywhere across the nation. And with millions of dollars being disbursed for the SNAP program, Damian says efforts need to be taken to crack down on the abuse. For example, some states ban certain food items from being purchased, to other proposals about drug testing, an effort that was even discussed a few years ago on Guam. Damian agrees to an extent.
It's almost like a random drug testing. It doesn't necessarily have to be 100%, but it would create a more awareness that not to do that. So if we get a call that says, hey, this individual maybe should be investigated for drugs, then we need to take it upon ourselves to verify some of that.
As for Committee on Health Chair Senator Dennis Rodriguez Jr., he says the best way to crack down on the abuse is to get down to the root of the problem.
I'm not really looking at something that's punitive, that punishes people, right? Because just like I said, it's really survival mode for a lot of these people. Because what happens when you do, drug test someone and they test positive, you take them off the rolls, it becomes a worse situation for them. If we're going to do that, we want to make sure we have a real good program that treats people who have drug problems. I think it goes back to making sure we have alternatives for them.
In the meantime, Public Health's best way of monitoring the program, aside from the reporting requirements, is through complaints received by the community. You can report fraud and abuse by calling the KEHA hotline at 735-7353. Reporting for Guam's News Network, I'm Ken Quintaniza.